Hello, in this health sketch we want to talk to you about idiopathic pulmonary fibrosis, or IPF. The word idiopathic means the cause of the condition is unknown. Pulmonary means lungs and fibrosis means scarring. So IPF is a progressive, scarring lung condition, the cause of which is not known. Though the condition is not well known, 5,000 people are diagnosed per year in the UK, and it usually occurs after the age of 50. While IPF has no known cause, it is thought that there may be certain triggers that cause the scarring process to begin, such as viral infections, smoking, and heartburn. It can also run in families. There's no known cure as yet, however there are things that people with IPF can do to help themselves. So how does IPF affect the lungs? First, let's see how the lungs work. When you breathe in, the air ends up in tiny air sacs called alveoli, where oxygen can move into the bloodstream and carbon dioxide gets taken out. In pulmonary fibrosis, scar tissue builds up over time around these air sacs, which makes it harder for oxygen to move into the body. This leaves you feeling more short of breath than usual. The main symptoms of this condition are breathlessness and a persistent dry cough, which both worsen over time, making daily activities harder. Tiredness, weakness, and weight loss may follow. Diagnosing IPF can be difficult as its symptoms are often similar to other more common lung conditions. However, if your doctor suspects IPF from your symptoms, you should be referred to a specialist for further investigations, such as breathing tests. A high-resolution CT scan, which takes very detailed images of the lungs, is used both for diagnosis and monitoring the condition. Another test involves passing a small camera through your nose or mouth and into your lungs to see what they look like or take a sample. This is called bronchoscopy. Another test involves a small operation under general anesthetic to take a small sample of tissue for analysis, which is called a lung biopsy. Unfortunately, there is not yet a treatment that can cure idiopathic pulmonary fibrosis, but there are now medications that can help to reduce the symptoms and slow the progress of the condition. Research into new drugs is ongoing. Pulmonary rehabilitation has also been shown to benefit people with IPF. This is a structured program of gentle exercises and education about your condition and how best to manage the symptoms. Physiotherapists and specialist nurses can show you techniques to reduce breathlessness. Oxygen therapy can be used if your body's oxygen levels become too low, perhaps needed only during physical activity, or maybe while at rest too. A lung transplant can be an option for those physically fit enough to undergo major transplant surgery. The progress of the condition varies widely in different people. While some may have stable symptoms for long periods, in others there is a gradual decline with worsening symptoms. Coming to terms with the diagnosis of IPF is often difficult, and it is particularly hard as the cause of the condition is unclear. It is common to feel low, anxious, or depressed, and it can be helpful to talk about these feelings with your doctor, a counselor, or at a support group where there will be others with similar questions, experiences, and feelings. Having the support of others can help to motivate people with IPF to stay as healthy as possible, for example, by attending follow-up appointments, taking medication as prescribed, and being vaccinated against flu and pneumonia. Stopping smoking is very important, as smoking damages the lungs and worsens the symptoms of IPF. It's also good to stay physically active, and eating healthily can make a significant difference by ensuring your body gets the energy and nutrients it needs. In this health sketch, we've talked about idiopathic pulmonary fibrosis, the scarring process in the lungs, the resulting symptoms, and how to cope with the diagnosis and stay as healthy as possible. We hope this health sketch has been helpful to you and those around you. Health Sketch. Health for all to see.